His Excellency Mr. Tan Ding Wangchuk, Health Minister of Bhutan, His Excellency Mr. Ramjanam Chaudhary, Health Minister of Nepal, Dr. Muhammad Habib, Honorable Dr. Poonam Khetrapal Singh, Regional Director, World Health Organization, Southeast Asia Region, Honorable Dr. Keiji Fukuda, Assistant Director General, World Health Organization, my colleagues from the Ministry, Excellencies, delegations from Southeast Asia region countries, distinguished international and national experts and participants, ladies and gentlemen. I take great pleasure in inaugurating this important conference on combating antimicrobial resistance. Indeed, antimicrobial resistance, commonly referred to as AMR, has perhaps emerged as the #1 public health challenge faced by the world today. This challenge confronts all countries, small or big, rich or poor, developed or developing. Understandably, therefore, combating AMR necessarily entails a collaborative and a synergistic action by all of us. India and the Southeast Asia region of WHO had taken a lead when AMR was identified as a major challenge, and the Jaipur Declaration was adopted by us in the year 2011 itself. I also feel privileged that during my presidentship at the World Health Assembly 2015, all member states unanimously adopted an action plan on antimicrobial resistance. This was preceded by long and difficult negotiations, viewpoints and counter viewpoints, and resolution of concerns and sensitivities to achieve a consensus. The time is now right to take stock what we have achieved in the preceding year in relation to what we set out to achieve. The first step addressing the problem of AMR is to avoid the need for antibiotics at all in the first place. This is best done through improved water and sanitation, in the absence of which the proliferation of the diarrheal diseases results in inappropriate antibiotic use. Through the Swachh Bharat program, our government has taken active steps to improve hygiene and sanitation and to reduce the environmental spread of pathogens. Vaccination is an equally important public health measure. Through Mission Indradhanush, India has set itself an ambitious goal of increasing routine immunization coverage to 90% within just a few years. Moreover, the ministry is soon introducing many new vaccines like rotavirus, which will both save the lives of many children and reduce the consumption of antibiotics. Excellencies, the complexity of AMR is not confined to the nature of microbes alone. The complexity is also fueled by numerous stakeholders impacting and by the AMR. These stakeholders include consumers, the patients who take the medicine, the doctors who prescribe, the pharmacists who dispense, the industry which manufactures, the government which regulates, and the research organization which innovate the animal and the agriculture sector, which contribute to the food chain, the hospitals which treat the patients, the civil society which articulates the people's perspectives, and the media which can focus attention on this important issue. It is imperative that all stakeholders connected with AMR sit together, talk, listen, contribute, and pave the way for effective action to combat AMR. In this context, our conference is both timely and useful. It is very heartening to see the overwhelming response, as is evident from this presence of so many distinguished participants in this hall today. For attending this conference, I am really grateful to you. Excellencies, I need not emphasize that AMR is not merely a health challenge. It has huge economic consequences too. Sicker patients have longer hospital stays, need more drugs, and this pushes them into poverty. World over, in rich and poor countries, we depend on effective antibiotics to treat infectious diseases that cannot be prevented within our health systems. But failure of antibiotics is putting our public health system and the economies at risk. We need to emphasize the economic gains to be achieved and equally important the potential economic losses to be avoided by timely investments towards meeting the AMR challenge. While health is wide canvas with different areas requiring our simultaneous attention, we must not forget to focus on IEC activity for creating awareness about AMR. Awareness levels must rise not only for the doctors who prescribe the drugs or the healthcare workers in the chain, but also for the patients who consume the drugs. In this connection, the launching of the media campaign with the red line to raise awareness amongst the general public that drug strips with the red line must be used only when prescribed by doctor is a welcome initiative. I am not aware whether similar rules and regulations prevail in my neighboring countries or other countries of the world. India, of course, notified these rules in the Drugs and Cosmetics Act some time ago. We have now incorporated a new H1 schedule for some drugs and third and fourth generation antibiotics that should be dispensed only after the details of the patient and presenting doctor have properly been recorded. Increased awareness levels of general public will also automatically caution the pharmacists who dispense the drugs so that they do not sell antibiotics over the counter. Simultaneously, curriculum under graduate doctors must lay more emphasis on rational use of drugs and correct prescriptions and practices. I am happy that young students who are budding doctors from different government colleges across India have been involved in the AMR poster competition and 20 best entries have been chosen for display before all of us. There is perhaps a need of continuing medical education packages for doctors with different levels of seniority to update their knowledge and guide them for correct use of antibiotics. A much needed health system reform is universalization of electronic health records so that every prescription in every hospital is captured digitally and available for scrutiny to prescription audits. My ministry has taken significant steps for electronic health records, and we hope to leverage most modern technology to strengthen the health systems and provide more patient-centric care. In fact, our focus should not be on drugs alone. We should also concentrate on the patient in terms of infection-free hospital, environment patients, rights for correct prescriptions and correct dosages, and patients' education so that awareness levels regarding AMR are enhanced. I am aware that different organizations, individuals and departments have undertaken considerable work for combating AMR. This is true for India and also true for other countries of the world. However, what has been done till now is not sufficient. We need a quantum jump. The path to be traversed is long and we need to move together. We must work in correct together and coordination, drawing on supplementing the strengths of each other. Challenges, some of them severe, will always confront us. We need not to duck these challenges. Rather, we should take them head on. Collective actions is required by all stakeholders within a country and by all countries within the region. India, of course, will be very happy to work with other member states towards the common goal. I look forward the roadmap on combating AMR, which I am told will be worked out by experts during this conference. I reiterate India's commitment, leadership and resolve to combat AMR, and I wish all success to this conference. Thank you very much.
Thank you very much indeed. That was our Honorable Union